right, we're live once again. We've waited our 2 months and we're here to present to you again. Dr. Kendle Dykstra, myself, Laura Marlborough, we're here to talk about equine massage therapy and equine chiropractic care and how it's like the ultimate collaborative team. So thank you everyone for joining. I do hope you enjoy today's session, as well as we'd love to hear your comments as well as your questions. So feel free to put those in the comments pull down menu there. Anytime you got a question, just throw it in there and we'll address it as we can as we go along, or at the end of the session, we'll have a little bit of a Q&A. But feel free to share this live session well with your friends and your co-boarders and everything like that. The more the merrier, and the more information we can get out, the more knowledgeable all our equestrian friends can be. How are you doing today, Kendle?
I'm doing great. Thanks, Lauren. How are you doing?
I'm doing pretty darn good today.
Good. Glad to hear it.
What's new and exciting in the chiropractic world?
Oh, I don't know about much new and exciting these days. I think we're all just trucking along and trying to keep our heads above water, but all's been going well in the chiropractic world. No complaints at all.
Good stuff. Good stuff. Well, why don't we get started? And I see that quite a few people are already starting to join us, but I'm going to formally introduce you. I know that quite a few of our watchers here today do know you very well, but for those that don't, let me introduce Dr. Kendle Dykstra. She started horseback riding at the age of 6 and over the years has dabbled in various disciplines. After years of wear and tear from the equestrian sport and the physical demands of farm work, she sought chiropractic care for herself for pain management and overall well-being. She gained a strong respect for the natural approach of chiropractic care and how it helped her body to perform and operate in the way it was designed to. So with this in mind, she sought chiropractic care for her horses and amazed at the difference it had in their performance. As is the way for most horse lovers, Kendle always had an aspiration of becoming a veterinarian, so she went to Brock University to obtain her Bachelor of Science. However, when she realized that it was not the career path for her, she quickly fell in love with the idea of becoming a chiropractor. She attended New York Chiropractic College for a doctorate of chiropractic, and as well as the Veterinary Chiropractic Learning Center for her animal chiropractic training. Kendle now offers chiropractic care for people out of Font Hill, as well as animal chiropractic services to the Niagara region. With her background in equestrian sport, she has an understanding of the physical demands on the equestrian body and a special interest in helping riders and their equine counterparts to perform optimally and in unison with one another. And I can attest to that because I work along Dr. Kendle Dykstra on several horses in a lot of different areas. And it's always great to be able to talk with Kendle. I think we talk almost weekly about some of our clients and keep each other on tabs and in our notes. I'm sure we're both there.
Absolutely.
So how long ago did you start Unity Chiropractic?
So it started just over a year ago now, last year in March, just before our world changed as we knew it, and everyone went into lockdown. So I just started back then, and luckily back in June of 2020 is when things in chiropractic services started opening back up a bit more again. So I was able to really hit the ground running in June and really kind of keep the momentum going from that point on. So it's been almost a full year, depending on how you look at it, of working with the horses as well. And it's been an incredible year. I felt so grateful every day for being able to do what I do.
Wonderful. I know that you work on me. I'm obviously a good case of yours. Not only do I like collaborate with the horses with you, but you also have to fix me so I can help the horses. So yeah, for sure. It's been pretty exciting. So basically what we're going to do today is just talk with one another, kind of have an interview kind of format and go over kind of the collaboration that we have and how chiropractics and massage works hand in hand. If you want to kind of get things rolling a little bit more.
Absolutely. Well, not that I feel like you need any introduction, but 4 stars for anyone who may not be as familiar with you as most of us. I'm going to just tell everyone a little bit about you. So, Lauren was born in Calgary, Alberta, was introduced to horses at a young age when she attended the Calgary Stampede and Spruce Meadows venues. She's an avid horsewoman for over 25 years in both riding, training, and competing in the hunter jumper discipline, and she has worked for several boarding and show barns, as well as a horse retail store within the horse health industry. Wishing to take her studies into the veterinary medicine, she graduated from Lakehead University with a Bachelor of Science degree in biology and furthered her degree graduating from Brock University with her honors in biological sciences. At this time, she reconsidered her career, similar to myself, and she reconsidered her career as a veterinarian and pursued a career oriented around health and therapeutic aspects of science, and happily took on a position at Omega Alpha Pharmaceuticals Incorporated in 2010. And then she started HealthEquine Therapies in 2012. She has been a certified equine sports massage therapist, Reiki practitioner, and has attended the Equine Science Certificate with distinction through the University of Guelph. She continues to enroll in courses such as equine acupressure, shiatsu, equine energy and advanced oil application, the equine health and emergency first aid, and trigger point therapy and equine aquataping practitioners training and practicum. Most recently, she's undergoing a course on equine craniosacral therapy with hopes of completion in 2021. Lauren takes a more holistic approach using alternative medicine and modalities to allow the horse's body to heal, repair, and maintain itself to reach optimal performance. Her services are offered in the Brantford, Hamilton, and Niagara regions.
Thank you, my dear. I appreciate that. what I totally forgot to do was show our pictures of what we actually do outside. So let me just throw those in there for you.
Better late than never.
We'll add Kendle here in the show ring.
Back in the good old days.
Right. We actually had time to show.
Exactly. We didn't work all the time.
And myself in the show ring. I actually came across one. It's been a while there too.
Woohoo! I love it.
Perfect. So much fun to reminisce and bring up some of these old photos, eh?
For sure. It's where the passion started, right?
Exactly. So another little tidbit that we're going to throw out there to everybody is that we're going to kind of go through a lot of our backgrounds or our professions. So if we do have a tendency to kind of look down, it's because we have our paper notes in front of us and we want to make sure we pronounce names correctly and don't forget our key points when we're expressing everything to you guys. So I'm going to let Kendle start. She's going to kind of give you a little bit of history on chiropractics.
All right. So for anyone who isn't familiar with the translation of chiropractic, so chiro comes from the Greek word hand, and then practic being like practicing, so practicing with our hands. So that's what chiropractic means. And so as it already alludes to, it did start back with the ancient Greeks, as well as Chinese and Egyptians. It wasn't a founded profession yet, but there's evidence in hieroglyphics of those types of activities happening way back then. The profession was founded by an individual named D.D. Palmer. He was actually born in Port Perry, Ontario, and so a little shout out for Canada there in Ontario. And then he later moved to the US and originally started as a magnetic healer. And then he's the one who performed the first modern day adjustment, which occurred in September 1895. Basically what had happened, there was a janitor in the place that he was working who had fallen off a ladder and lost his hearing around the same time. And that lasted for several years. And D.D. Palmer observed that there was like a protrusion in the janitor's neck that started after that accident. And so he decided that he should adjust that protrusion. And so he adjusted that spot, and Harvey, who is the janitor, his hearing immediately returned. And so he felt like he was onto something, and this must mean something. And so that's kind of where the profession really started. So D.D. Palmer and then his son, B.J. Palmer, they started a school to teach others how to do this, and the profession has just further grown from there. So at that time, they interpreted the need for adjustments and the reason for any improvement from the adjustments themselves is being a result of pressure on the nerves throughout our body. So when the bones were sitting like out of place, that they would put pressure on the nerves and then affect the function of the nerves. We have come a long way in the research and understanding of what truly happens with an adjustment. So it's less of a pressure directly on the nerves, and now it is looked at as something called a vertebral subluxation complex. And basically what that means is there's various components, including joint motion, the nervous system, the vascular system, and connective tissues and anatomy, as well as biochemical processes and all that nitty-gritty stuff that is all influenced and all plays a role in what happens when we have joints that don't move properly. So it's not that there's a bone out of place, that we're pushing a bone from one place from one place to another, or that there's a pinched nerve. There's not very much scientific evidence for that. So it has emerged to more of this complex understanding now. So the Palmer family found the first chiropractic college in Davenport, Iowa, and it still exists there. And then shortly after that, so the first veterinary chiropractic program, so chiropractic care for animals, the first schooling that became available for that, was created by B.J. Palmer, who, like I said, is Dee Dee's son, and that happened in the early 1900s. So pretty shortly after chiropractic started for people, it started to be transitioned over to animals. From there, other people have, continued to elaborate and grow the animal chiropractic schooling as well and understanding. Now there's currently 5 approved programs by an organization called the American Veterinary Chiropractic Association. There's 1 in Canada, 1 in Europe, and 3 in the United States. So the one that I had taken in Canada here, it's called the Veterinary Chiropractic Learning Center, and basically it's an accumulation of over 200 hours covering various topics, including neurology, anatomy, biomechanics, pathology, obviously the technique, rehab, the science behind it, and all of those nitty-gritty things. So you have to either be a vet or a chiropractor to take this postgraduate program, and after completing successfully all of those subjects and exams and everything involved, then that's how we can offer animal chiropractic services.
It's funny how these modalities start, isn't it? Something
absolutely
so random that it became so historic and has grown over the years, right?
Absolutely. I can't imagine looking at someone and being like, oh, you've got an area that's kind of poking out a bit. I'm going to push on it really quick and see what happens.
That brave janitor, too, to let him do that and not know what the outcome would be, right?
Absolutely. Absolutely. So I think it's a beautiful thing, but certainly crazy to think the very early days of it and how much we've learned since then. Right. Now, can you tell me a little bit more about how massage therapy got started?
Sure. It's known as one of the earliest tools that people used for actual relieving pain. And when I kind of looked back at the history, I was quite shocked on how it progressed from the Eastern to the Western world and how it's developed even into equine massage therapy. Mm-hmm. So I do have a couple of notes, points that I'll kind of read out, but basically it dates back all the way to 3000 BCE or even earlier, and it actually originated out in India, where it was considered a very sacred system of natural healing. So very similar to that of today with its natural healing components. Then it kind of migrated into China, into Egypt, into Greece, and then of course with the father of medicine there, he kind of treated physical injuries in the 5th century with friction, which has now become a big major technique in massage therapy. It kind of progressed into the Western side of the world in the 17th century with its new discoveries in pharmacology and medical technology, which changed modern medicine. In the early 1800s, Swedish doctor Dr. Link created a method that became known as the Swedish movement cure to help relieve chronic pain. And this then developed into women being hired by surgeons to treat orthopedic problems. And they were referred to as rubbers at that time. So they would be a massage practitioner and help patients through any kind of pain or discomforts they were associated with. By the late 1800s, the name masseuse became very popular, and the demand for masseuses increased in the 1900s. So by the 1930s, Swedish massage had evolved, and the physiotherapist, who's used in regular medicine, helped massage therapy to become a legitimate and respectable form of medicine. Once physical therapy was licensed in 1950s, massage therapy had its very own category, and that's where it kind of grew from there. So between 1970s and 2000, massage therapy experienced a transformation as people chose to live healthier lifestyles and preferred more holistic approaches to healthcare, pain management, and restoring and maintaining healthy bodies. Now, you've focused on the chiropractic part, and I've done like the human massage part, but there is obviously a second part to the career I've chosen, which is the horse massage therapy component. So I'm going to give you a little bit of background on that as well. So although historians believe the ancient Greeks massaged their horses as well as their warriors before battle, little is really known about the history of equine massage therapy. In fact, they have one gentleman by the name of Jack Marr, who they fathered as the sports massage therapist. And believe it or not, he's a pretty recent alleged guy to be coming at the forefront of equine massage therapy. He originally started as a World War II medic. He attended the Massachusetts School of Physical Therapy before dedicating his life to solely working with athletes. Through working with the NFL, he developed a technique known as sports massage, which led him to the diagnosis of the underlying issues affecting muscles before developing any sports injury. So it was, again, purely by accident that he came into the first profession of equine sports massage therapy. And this occurred only in the 1970s, where we started using sports massage techniques with horses and actually became part of the US equestrian team for the 1976 Montreal Olympics. So again, back in Canada. Since the 1970s, other approaches to equine massage has also been developed. In fact, many forms of massage used for humans are now used for horses. So beginning in the early 1990s, it has really been a growing field for equine therapy, utilized for both day-to-day riding as well as post-trauma rehabilitation and preventative measures. So very, very new to the equine world, really, as a source of therapeutic benefit for horses. And so I thought that was really quite interesting, and I really wanted to share that with everybody because, you think massage stemming back from like the early days in India,
of course,
to having massage therapy for horses is only very, in the last 30 years or so, right? So it took me back a little bit, so I was happy to bring that to your attention today.
Well, horses these days are very lucky to have that
right?
available.
I actually do have a picture.
Widely accepted and known about these days as well.
Yeah, precisely. So there's a picture of Jack Marr there working on a horse.
Amazing.
And I believe he's also created like an institute down in the States for massage therapists to work on horses down there.
Fantastic.
Yeah. All right, so why don't we jump on to what chiropractic entails? What do you do when you go see a horse that needs some chiropractic care?
All right. Well, any practitioner's approach may be slightly different. We each, just like in any field, we all have our own kind of approach and nuances. But the way I go about it is I like to obviously have a look over the horse. But the biggest thing for me is watching them move. I really need to be able to mechanics and ideally see their range of motion in various activities, and in some ways hopefully replicate and demonstrate some of the complaints that the rider or the owner may have as to why they're bringing me out. So whether it's a performance issue or something more subtle, sometimes we're able to watch that just watching them go on the lunge line or even trotting in hand, depending on what is available. So I watch them move, see how they utilize their bodies and engage their bodies and asymmetries they may or may not have. And then I do a few different range of motion assessments as well. And this may include, I pretty much always includes bum tucks. Anyone who knows me, this is what I do with a lot of my animals. But then taking the joints through the range of motion as well, and asking for different exercises too. So sometimes I'll ask them to do a carrot stretch and kind of see if they have similar range of motion and freedom available. So I can kind of see what their defaults or their go-tos are, or their cheating habits that they may have developed. And then use that as part of the clinical picture that I put together once I start individually assessing each of the joints. So at that point, that's when I get up onto my bales and I have a feel through from tail all the way up to their nose and then into their legs. I feel through each individual joint to assess for tenderness, stickiness, if you will, a decrease in that motion and decrease in what we call joint play. And then kind of put that whole clinical picture together to see if there's things that add up and make sense to what the owner has concerns about, and then the things that I'm finding as well, and try and put that whole big picture together as one. So once I find those joints that aren't moving as well as they should, I do an adjustment, which is a high velocity, low amplitude, which just means it's a fast but not forceful thrust into the joint along the range, like the plane of motion that joint is supposed to have, to stimulate that joint and try and restore that normal amount of motion that joint has lost for one reason or another. And so kind of work through tail to head doing that, and just really trying to get everything working together again. And so a lot of people think that in treating a horse, I have to use a lot more force than I would, doing adjustments on people or other animals. And it's really not true. Generally, I'm using the same amount of force on a horse as I do my people, just because we're adjusting an individual joint as opposed to the whole animal in the adjustment. So it's all very specific, very targeted. So it's really a very comparable force to what my people patients require. And so it's still very effective though for the horses. So sometimes though, some horses are not able to tolerate a typical adjustment. So every horse is different, kind of depends on what we call their sympathetic tone. So kind of how primed the body is, if it's really kind of in this flight or fight kind of way of being, or if they're super painful, or say they are rehabbing something, then we will do other things that are tolerated better, such as mobilizations. So basically encouraging that joint to move within its passive range of motion, so the range of motion that it would go through anyways, but not into or beyond their passive range of motion. So the adjustment, when we perform an adjustment, goes a little bit beyond what we would, that range of motion that we would get if we just gently put a little bit of pressure into that joint. So it goes just beyond that to restore that motion, whereas the mobilization doesn't have that next step. So we'll offer that just to try and encourage some motion if an adjustment isn't called for at that point in time for one reason or another. Sometimes tonal work is an option as well. And what that means is Like there's a covering around the spinal cord. So obviously I can't directly touch that spinal cord. It's covered by a lot of very big structures that are in place for a very good reason. But we can put some pressure on different ligaments and different areas of the body to try and decrease tension through directly through that central nervous system itself. So it still has an impact, quite a potent impact on the nervous system, and it can help to decrease some tension that is being held through different areas, even if it's not as targeted to one specific joint. But for some animals, that's a really great place to start when they are in a bit more of a primed position and can't tolerate as much adjustment and as much work as a horse who has less going on.
Very good. And so I know a lot of people are always concerned about themselves going to get a chiropractic adjustment, but more so sometimes with our beloved horses. So what exactly is that popping or cracking noise that we might hear when you're working on one of our horses?
Sure. So certainly it's less common to hear that when we're working on the horses compared to people, just because of the degree of muscling and the depth of those joints through all those soft tissues. So not something we hear as often, but certainly can happen. And when that occurs, all that pop noise or cracking noise is that you're hearing is the release of built up gas inside the joint. So a joint is full of synovial fluid, so it helps to lubricate the joint and keep the joint nice and healthy. And so it's a fluid, and just like any liquid or any fluid, we'll get gas particles that intertwine into that liquid. Now, when we do an adjustment, what we are doing is we're changing the pressure that builds up inside of that joint. And so in that quick change of the pressure in the joint, that pop noise happens when we get the release of that built up gas in that fluid. So it's not that anything is cracking, nothing's breaking, nothing's snapping, anything dramatic like that. It really is just the change of pressure inside the joint and then the gas that releases. So just like if you were to crack your knuckles, that popping noise is the same thing. So it's not necessarily that we're, restoring motion when we do that. We're just changing the pressure in that particular joint, and that's when we get that release. So same thing in our animals and our horses.
Now, for myself, when I'm working on horses, I have to watch their body language, and sometimes they're very black or white about the whole, this hurts, this feels good. Do you kind of have to look for the same changes in their body language or facial expressions, those kind of components when you're working as well?
Absolutely. So obviously a big component of what we do is getting up close and personal with these animals. That requires a lot of trust from them. So I certainly do everything I can to maintain as much trust with them as possible. So if it means they are more painful or feeling uncomfortable or unsettled with work I'm doing, and I can see that change in their body language associated with the work I'm doing, I'll often take that step back, either try and, just coax, encourage them, give them some treats, try and warm up to them and scratch them, just kind of get them to settle back down. Or, I'll take that as an indication that maybe we have to take a slightly different approach. So doing something more like a mobilization or tonal work instead of the adjustment, depending on how unsettled that horse is. But then of course there's safety to be considered as well. So, myself, and I know for you, we're up close and personal with horses, and if we're doing something to them that they really aren't tolerating well, it's not for anybody's best interest to continue to go beyond that. So, and taking the animal, like the horse's safety into consideration, and my own, and like I said, I'm sure for yourself as well, it's very important to really keep an eye on how they're reacting and responding, and just making sure it's a positive experience. And then obviously just trying to make sure that they aren't getting pushed past their limit as well, because it is a lot of stimulation to the nervous system. And we really have to be careful to not overstep their limitations, because it can be a little too much stimulation right off the bat for some, depending on like all the things that they may have going on at that particular time and their state of their overall health and well-being. So there's a
Yeah.
lot of factors that we have to consider.
Yeah, it's definitely being able to read everything, right? Whether it's their stance, their facial expressions, the way they're releasing their tension,
Yeah.
just overall body tension itself. Yeah, it's a lot to read. And it's always helpful to have the owner there as well, because they can
Yes.
give you a little bit of insight, because obviously they're going to know their horses better than we are. So having the owners there is pretty important for me, just for safety reasons, but also to help me with their horses and better understand them.
For sure. And I think it plays a big role in giving us the most accurate clinical picture as well. So, areas that maybe the joints are moving well, but then the horse indicates that they're uncomfortable, or, areas in their body that they're uncomfortable, even though the tissues themselves may not feel alarmingly abnormal, then that's still a very valuable piece of information into what might be going on throughout their whole body and into their clinical picture and any complaints that the rider may have in their animal's performance as well.
For sure. Now, I noticed in one of your pictures, and I know for what it does and what it is, but you carry this block with you. And as a massage therapist, we don't need those unless we have a really tall horse that we have to have a step stool. But you carry that with you at all times. So do you just want to kind of tell us what that's all about and what it's used for?
For sure. So I take two with me because sometimes I really need a little extra help. So those big blocks are to help me position myself so that I can accurately assess each individual joint at the proper angle for each of those individual joints. So sometimes it means I have to be able to be up and over top the midline of the horse. And I certainly can't do that from the ground unless it's a mini or a really small pony. Unfortunately, my go-go gadget legs to shoot me up higher have not come in the mail yet. So in the meantime, I have to use these veils in order to position myself appropriately so that I can use my body to most effectively assess it and then help the horse by performing the adjustments. So they're just a lightweight block. They look big and obnoxious, but they're just a foam block. So they're lightweight. They're just very cumbersome at times, but I could not go my day without my blocks. They are essential. Now,
Yes.
you must have some must-have items on your list that you carry around with you all the time too.
Oh yeah, I have my bag of tricks, as I like to refer to them, but nothing specific towards. It's more complementary to what I do. It's not necessarily have to use them like you do with your block. You have to have that with you. But going on to what chiropractic entails, massage is actually quite similar as well. Like you talked about going through the history of the horse. I always try and get some information from my clients. I usually ask them to go into depth about any kind of injuries, any kind of medication they're on, any kind of issues they're having currently under tack or in hand. If they're kind of having anything specific going on, I kind of want to know any kind of history detailing that. And again, like yourself, I like to often see what movement they've got going. So I do a little bit of a gait analysis, asking for them to trot in hand or put them on the lunge line. Now, I don't always do this, only because sometimes they're just wanting their horses to have a little bit of a maintenance massage. It's more like a treat, where I'm sure with chiropractic, it's a little bit different of an approach because it's more specific to what they're looking for. But I often get, this is just a little spa day for my pony. So in that case, I really don't have to look at the gait itself. But for like the big sport horses, those competitive horses, or those with pre-existing injuries, then I really do like to kind of have a closer look at what's going on. But often it's getting the details from the owner itself that really kind of puts everything into perspective for me. Then I'll put
That's
my hands on the horse. I will obviously introduce myself to the horse, and kind of talk to them as I'm kind of placing my hands on the horse and kind of feeling along the top line and through the rib cage, just to see if there's any kind of flinching, spasmodic activity, any kind of tension reaction from the horse. So it kind of builds the story a little bit more for me. Things I look for are definitely looking at the hip axis and seeing how balanced they are and how those point of hips are orientated. I also look at the heels and pasterns because oftentimes and not, it could be a little bit of a foot or shoe issue. So looking at those heels, seeing how low they are to the ground or the angle of the pastern in comparison to the shoulder angle of the horse can give me a little bit of a storyline as well. Obviously looking at the conformation, the hind limb and the forelimbs and what they tell me, you know, if are they got a little bit of a sickle hawk kind of component? Are they very camped underneath one another? Are they kind of toed in, toed out? These give me a little bit more details on what could be happening with the musculature as well. And then recently, having learned a little bit of the craniosacral, I've learned that you can look at face symmetry as well. You know, how the nostrils are symmetric or the eyes are offset a little bit, even the ears, things like that. And they can relate down to anything from like the TMJ to any kind of back issues. So that's something else that I look for. So a lot of people might find it a little funny when I'm standing right in front of their horse and kind of assessing the face, but I thought I'd throw that in there just to kind of let everybody know. Now, when it comes to the massage techniques, there's basically 5 main ones that massage therapists do. The first one you'll often see us do is called Effleurage, and it's just a very gentle stroke or patting of the area. And this just kind of starts the process along by kind of stimulating blood flow to the area, kind of warming it up before we really go into the manipulation of the muscles. One kind of component would be that of like compression, or in the massage world, we call it Pestressage. And this is just applying constant pressure to stretch those muscle fibers apart. So you might see me using a fist or the palm of my hand, kind of pushing in there. I've also started using a little bit of trigger therapy. So you might see me use my fingers or applying pressure with my thumb on any kind of nodule or knots. So these kind of work comparably with one another. Friction is another one, and this is more of the rubbing of the tissues back and forth across the direction of the fibers. So we're going in the way of the muscle tissue itself. And then there's percussion. I don't do this very often because not a lot of horses really kind of lean into it, but it's essentially, for lack of a better term, is actually kind of using your hand and beating on the muscle. So usually I'll use like the side of my hand, or I'll use a fist kind of component. And another one I use is actually kind of like a clapping motion, and it's usually on the underside of the belly, because some horses don't like to be rubbed on the belly, particularly those mares out there. So I usually a little bit of a clapping behavior, which kind of takes people off guard, but that it's another percussion kind of system that we use. Last but not least, finger raking. It's just a form of kneading in the muscles. And a lot of the time I'll use this in between the ribs, in those intercostals. I can kind of just glide my fingers in between the ribs, and kind of separate them a little bit. But you know, there's everyone kind of uses their techniques differently. Everyone kind of starts in one point and works to the other. I try and start up right at the masseter muscle, the jaw muscle, and work my way back and then do the other side. But I know for some chiropractors, they work from the back front. Is that true? Why do they do that?
So I mean, in people too, it's very similar. But in horses, like that hind end is really that powerhouse, and where all of that impulsion comes from, and everything that we ask them to do, really, that their lifeline is their hind end. And so oftentimes when we start to see things happening in the front end, it's usually secondary to something going on in behind. So for example, if I have a horse who is more sensitive, and I know for one reason or another isn't going to be able to tolerate a full body treatment all in one session, if at all possible, I do try and at least start in the hind end because it has such a profound effect moving forward. So as you can imagine, if they're driving from their hind end, or if they can't drive from their hind end, everything up front has to compensate and make up for that, and that's anything behind that pelvis. So, or anything that's moving forward from that area is going to have to compensate for stuff in the hind end. So even if it seems like you're skipping over a lot, if you have to really pick and choose where you perform your treatment, it can really make a profound effect on the whole body by at least starting there when possible, because you can have a lot of relief and extra stress relieved higher up. So oftentimes that's where I get most of my information from, and I can explain things going on in the front end based off of what's going on in the hind end. Of course, every horse is going to be different, but it's a really big area to start the treatment, and then things can really start to change as you move up. So even if I were to go through a horse and just feel each joint and not necessarily treat them initially, and just kind of feel each individual joint from tail to ears, and then go back and start to treat from the hind end and then work my way back forward again. Often some of the areas where you previously palpated or felt that there were restrictions start to ease up before you've even adjusted that spot because of working in behind at first. So the whole body is so connected, and so it really is impressive to see how working somewhere else can affect another area. And so in horses, starting in that hind end is really a powerful place that you can have a lot of stimulation. Plus, it's also really nice because they're what we call parasympathetic nervous system is very targeted and very dense in that low back pelvic area. And so if the animal's not too painful there and we can stimulate those areas, we can really start to encourage that rest and digest state of mind, which puts them in a great mindset as we continue to work forward as well. So there's a lot of benefits to starting back there.
And very similarly, as a massage therapist, when I'm doing assessment, I often deem one side the good side and the other side as the bad side. And we tend to want to work on the good side first, because if there's any issues on that good side, it might have an effect on releasing on the bad side.
Sure.
And so I often get questioned, why are you doing it on the left and why are you doing it on the right? And so I have to kind of explain that. But very similarly, like, we have our places where we need to commence. So even though they're very different, there's reasons behind our madness for doing so. And I can totally attest to that parasympathetic system in the hind end. I don't think one horse that will ever say, no, don't touch me on my back or going down my glutes or anything like that. They just kind of go into that tranquil state, that Zen state. And so it must be really nice to start in that area rather than around the mouth sometimes.
Right. We all have our areas that we just relax that much better, and that hind end is a very powerful place for sure.
Absolutely. More ways than one.
Absolutely. Now, I have a question for you. When you're doing your massage work, do you always use your hands, or do you sometimes use tools to help you as well, or is it all by hand?
Majority is done by hand. In instruments or to lasers, to things like that are really going to complement them. For the most part, it's more manual though. So you'll see us with our hands or elbows or any kind of upper body limb, basically, we can utilize to kind of work on areas. So yeah, there are tools out there, and I'll touch base on those a little bit later. But as for yourself, I'm sure you've got some tools. I know you use tools on me once in a while, so I'm sure there's some out there for the horses.
Yeah, absolutely. Similarly though, I definitely use my hands more than anything else. So some practitioners will use tools called an activator, or they can have different names, but they're like a little spring-loaded device where you pull a little handheld trigger, and it provides like a little click noise where that spring pulls back, and it provides that impulse to the joint that you're trying to target. So there's definitely some chiropractors who use that, whether, again, animals or on people. And I definitely use that on people more than I do on animals. I find like horses and dog, they don't usually like the extra noise and find that intimidating. And so I really try and keep it as simple as possible and use my hands because, like I said, I'm not having to use more force on the horse either. So than I am on a person. So I am still able to use my body without too much added, stress on my own body. And I just get that much more feedback from doing the adjustment with my hand because I get my own feedback from how did the animal or the horse respond, but also did the joint feel like it released well? Was there a lot of tension through a lot of the surrounding tissues, like the muscles and the ligaments supporting that area? And I can't quite get that same feedback when I'm using a tool. So personally, I use my hands on all horses I work on.
Yeah. Your hands become your eyes when you're on the body, right? You can feel different things and kind of have an idea on how to approach it. So tools are not always the answer. Sometimes having a professional that uses their hands can give you a lot more detail on what's going on underneath all that skin and tissue and how it can help your horse, right?
Yeah, and over time, I find that, even in the start of my chiropractic training from day one and then to now, like my hands become that much more sensitive to every little change in tension and tone and twitching and reaction or anything like that. You become more and more sensitive to all that all the time. So before I started any of this training, the sensitivity was not there. So it's one of those things that really has developed for me over the years. And it provides so much valuable feedback on so many aspects. So it's just as much an assessment tool and the feedback my hands get as it is what the feedback my eyes get by watching the reactions and the movement and everything.
Yeah. And then you can really think about the biomechanics of it all, right? You can feel something that's tight and then associate it with maybe some sort of like hitch or lameness. And then you can kind of put the two together or try and put the two together to figure out what's going on and hopefully alleviate that tension or discomfort that the horse is exhibiting, right?
Absolutely.
Well, that kind of puts us into a segue on how massage and chiropractic care really kind of does work with one another. So let me I keep forgetting to put pictures up. And I have them all here for you guys. So this is a little bit of how they work together to kind of give everybody an idea. It's always good to have these visuals here. So basically, they work on two very different aspects, but together they're able to kind of basically have that muscle function through the coordinated movements and timing because of the messaging that they're receiving from that nervous system through the spinal cord. So the muscle functioning is more orientated toward the massage, where that nervous system is more chiropractic. Is that right?
Yeah, for sure. And that being said, muscles play a huge role in the nervous system as well. So certainly you make a big impact on that in the work you do as well. But the adjustments can really help to reset the nervous system when things kind of go a little bit awry and don't function as the way as they optimally should. In addressing the joints and the restrictions in the joints, we make a big impact on that nervous system because that spinal cord runs almost all the way down the spine, and the nerves kind of transverse throughout from the bottom of the brain all the way down.
Yeah, so in turn, it actually reduces kind of any restrictions on both the bones as well as the muscle tissue, and this allows for things like increased circulation, which reduces inflammation within the body. The communication between all that works really synergistic with one another when these two modalities come together. So it's a very good communicative skill for the body to learn, and that's why massage and chiropractics are essentially the most ideal combination when it comes to body work and therapeutic benefits.
Absolutely.
Now, the alternative, how do they differ? So why don't you kind of just give us a little bit of information on, we know what chiropractic is, but in comparison to massage, how is it different?
Sure. So, hopefully we have started to answer that a little bit already in our explanation of things. But chiropractic care is really going to target the joints of the body. So from all the way along the spine and through the extremities as well. So through the hind limb and the forelimb, really focusing on the joints and the way that they move and allow the body to be utilized. So we do some, targeting of some tight muscles sometimes when we're working through the body, but it's by no means the extent of a massage. And so in doing the adjustments, we really help to try and reset the nervous system. And so it helps to improve the communication between the brain and the nervous system and the body by knowing where it is in space and having that strong communication through the nerves to all the muscles as the body's being told, to use itself in the different tasks we ask of our horses or that the horses have to do for daily activities as well. So really focusing on the skeletal side of things and the nervous system side of things. And I'll let you talk, your big differences.
And on the opposite hand, massage works mainly on the soft tissues. So primarily like ligaments and tendons and obviously muscle groups as well. So they're like the musculoskeletal system obviously has a very big association with muscles and joints. And so again, this is where chiropractic care and massage really does collaborate well with one another, although they're two very different modalities and have two different effects on the horse's body as well as the human body itself.
For sure.
So now that we kind of know what
together.
Yes, exactly.
Sorry, there's
now that we've talked
about in the video here.
Oh, that's okay. I think I'm getting it on this side as well. So we've talked about the differences. We've talked about how they work together, but individually, what are their benefits? So what is the benefit of chiropractic care or getting realigned, as most say?
For sure. So there's a few aspects, as again, we've kind of talked a little bit about, but the big thing being improving those biomechanics. So basically the way that the horse is able to use their body to move, and the neurophysiology as well. So what that means is basically the state of inflammation and the nervous system signaling, able to enhance its performance and make sure that the communication that is happening between the body and the brain are as accurate for the most accurate feedback to the brain as possible, so that then the information going from brain to the body can also be as accurate as possible. Helps to decrease and improve hypomobility. So basically that means decreased range of motion and stiffness through the spine as well as through the extremities. And that overall cumulative effect is going to help improve range of motion. There is, with the nervous system signaling, it helps to decrease the signaling to muscles to guard. And so it can reduce muscle tension through those nervous system reflexes, and helps to reduce pain and that hypersensitivity or hyperirritability. So basically when we get inflammation building up that's not able to move back out because of the joints in the area being really congested or restricted, then everything stays in this heightened state of irritability. So, you can imagine if you had a sunburn and then someone touched you, you're going to be that much more sensitive to it than if that inflammation from the sunburn wasn't there. So that same kind of principle of decreasing that heightened sense of irritability.
Perfect. So on the counterpart, With massage, let me just bring up the picture there. Here we go. Here it comes. There we go. So when it comes to massage, very similar to that of chiropractic adjustments and alignment, one of the main components is obviously it promotes muscle relaxation. This will help decrease muscle tension, any stiffness or muscle fatigue that the animal or human is exhibiting. But it in turn helps to improve mental and emotional resilience. So it lessens the impact of any kind of stress that the horse might be under. This in turn restores extensibility and any kind of deformation of muscle. So even though it's focused on relaxation, it has an impact on the rest of the emotional state of the horse as well. It relaxes that central nervous system, so just encourages the mind and the body to relax, then again decreases stress and obviously reduces the anxiety that the horse might be exhibiting. And this will also help them take to the massage even better. It improves circulation. Circulation is really important because it delivers oxygen and nutrients to stimulate healthy muscle function. It reduces any kind of blood pressure and thus the heart rate of the horse. Again, puts them into a little bit of a state of relaxation. And in turn, that circulation and increased blood supply promotes healing, reduces pain, increases muscle efficiency, and has the potential to prevent future injury as well. Massage can increase lymphatic flow. So essentially, the lymphatic system is throughout the entire body. And the idea of the massage encourages lymphatic drainage, which detoxifies tissues and supports immunity and immune function. So any kind of pathogen or environmental toxin can actually impact the horse's muscles. And so by encouraging lymphatic drainage, it kind of rids the body any kind of buildup toxins that could affect the musculature. It improves posture and biomechanics. In turn, it decreases any kind of spasm. It increases muscle tone, and I've heard that it increases muscle tone by 20%, according to a recent study. And like chiropractic care as well, it increases the range of motion. And there has been a little bit of study that, again, similar to chiropractic care, that it aids in kind of respiration, digestion, and obviously the process of elimination. And honestly, those three things can actually be seen in person when a horse is being massaged. They kind of take the big deep breaths and sighs. You can hear the stomach kind of start to gurgle, and then the horse is in a total relaxation state. You might see the elimination of some manure coming out that end, and the owner having to do a little bit of cleanup duty. But all of these are really kind of beneficial. So you'll notice that a lot of what's going on with the benefits of chiropractic care and massage therapy are working in unison with one another for an overall effect with the horse. And I put a little slide together to kind of show the combined aspect of chiropractic care and massage in its entirety. So let's just bring that one up so everyone can see that one. And we can kind of expand on this a little bit, Kendle, if you'd like to. So these therapies extend physical and emotional health for the wellness of each treatment, benefiting the patient in a variety of ways. So why don't you just talk about the first one there, the maintains optimal alignment for a more extended period?
For sure. So when the joints are able to move optimally, the muscles are able to then function more optimally as well. So there's not that like rusty joint, basically, where things aren't moving the way they should. So those muscles are then having to work harder to make the body move the way that we're asking the body to move, and vice versa. So if the muscles are getting super tense and tight and overworking or overstretched or irritated for some reason, then the joints have to compensate as a result. So when we can really make sure that both aspects are functioning as well as possible. It means everything can kind of work like a, well-oiled machine, as the phrase goes. So everything can really work together without causing any added stresses or compensation that has to happen when things start to fall apart a little bit in one way or another.
Yeah, and in turn, this kind of brings us right to the next point. It speeds up recovery. Having the optimal alignment, the muscle and soft tissue being a little bit more pliable, the animal's able to recover, and obviously having that increased circulation component from both the chiropractic care and the massage helps do that as well. But obviously, if that well-oiled machine is working optimally, it's also going to prevent future injury from happening, right?
For sure. Yeah, like you can imagine, or I'm sure many of you have experienced, if you say sprain your ankle or have a sore knee and it's really bugging you one day, and you start compensating in the way that you're getting around, well, guess what? It's not just that ankle or that knee or wherever it is that where it all started that hurts. You eventually start to get sore other places because you're having to use your body in different ways unevenly to offload. And so if we can really decrease the frequency of that happening and try and eliminate that altogether, then everything can work together happier. We don't have to compensate. We can take those added stresses off other areas when everything is able to use itself optimally.
Perfect. Now, this one is kind of a unique one. The two modalities essentially boost the immune system function. And not a lot of people think about this, and it's very true, because obviously if we're releasing toxins from the body, whether it's through massage or through that lymphatic system that I was discussing about, or just putting the whole spinal column in alignment, allowing for those nervous systems to function properly, it actually has an effect on the immune system to keep the animal feeling healthy and functioning well throughout its body. So it's not one that's really touched up on, but I thought that was a really unique attribute to having the combined benefits of massage and chiropractic care.
For sure, absolutely. Overall health has profound effects throughout the body, right? It's not just one area that gets affected. So I think that's a really good point. And then going into increasing blood flow, that helps to take away toxins and buildup of bad stuff as well. So we really want to be able to make sure that we're providing the appropriate nutrients to the tissues. So both the muscles as well as the joints. The joints need nutrients as well to stay healthy. And so having good mobility and motion helps to keep blood flow coming to the area, to keep all those tissues as strong and healthy as possible. So joint fluid, the bones themselves, as well as all the tissues that surround. So your muscles, your ligaments, and all your soft tissues, they absolutely need blood flow. So keeping that going strong and evenly throughout the body as much as possible is very beneficial for sure.
And with increased blood flow, you're going to have that increased flexibility, which in turn has the ability to relieve any kind of pain and discomfort, because everything being back in alignment and back in the position it's meant to be has the ability to reduce inflammation, and thus inflammation is what circulates into pain. So if you can reduce that inflammation, the pain is going to decrease as well. And that in turn helps restore mobility, right? It's a very interesting, intricate circle of how everything can work in unison. So, increased flexibility, increased blood flow, relieves pain, restores mobility, and then obviously at the end of it all, it improves muscular skeletal function and range of motion, right?
Absolutely. You can't have one piece of this puzzle without the other. So it's amazing how everything can come together and the global effects that it has for overall well-being.
Yeah, and being able, again, to be able to converse with you on a weekly basis about some of the clients that we have, we can kind of essentially make it a tag team effort, and you can tell me, okay, this is what I notice in this area, and I can kind of give you the feedback of what I find, or you tell a client to contact me, or I tell them to contact you, because there's more something specific orientated toward more chiropractic care or massage, and it's great to have someone to do that with, which is not everybody's luck. But for our clients' sake, like, we can help improve all those bullet points that everyone saw there, as a combined team, right?
For sure. Absolutely. And, I've already said, but, there's so much impact and reciprocation between the muscles and the joints and vice versa. So to really be able to say, hey, this is what stood out to me on this day, and then, vice versa, and be able to get that full picture of what's going on for that horse at any given time, and their response to care and how much progress has made, from that full body perspective, is huge. Is absolutely huge, and I certainly appreciate being able to work with you, as well as other providers in different fields, to be able to really get that full body approach, because it's never just one thing. You need to have proper vet care to make sure that your horse is healthy, and that they are being managed accordingly if they do have various pain components that need more aggressive treatment. And then you need to have, a great farrier who's keeping your horse's feet comfortable and balanced, and making sure that they are set up to do the job that that horse is being asked to do. And the dental work and the other body work like Equibo and everything, it all comes together. Saddle fitting as well. It's never just one thing. So really being able to take that whole body approach and collaborate with other providers really allows for the best outcome for the horse, for sure. And the whole team.
Perfect. Yeah, absolutely. Yeah, the team approach. So we're going to kind of narrow it down now to some questions that came up, and I thought we could definitely address them. Which of them, so one of them being, and it's a very good question, so which is better first, massage or chiropractics? It's the chicken and egg analogy. So why don't you talk about massage before adjustments?
Sure. So when I see a horse shortly after they've had a massage, it is great because it allows me to be able to get in more comfortably for that horse to the different joints and different areas throughout their body, to be able to provide the adjustments. There's less muscle guarding, then I'm able to get closer to those joints. As you can imagine, those joints are a lot deeper and not super close to the surface. So when I don't have to fight through a bunch of really strong muscle, that allows me to do my job a little bit more efficiently for both the horse as well as myself. And so it makes my job a little bit easier, if you will, and often because of those benefits of that relaxation and just that contentment that horses will get from massage work and body work. And often, I find they're in this great kind of state of mind, just from having that tension relieved already, and they're already kind of in a happy place. So it certainly makes for an enjoyable experience. But that being said, sometimes if I haven't seen that particular horse before, it can make it a little bit more work for me to really kind of hone in on what exactly may be going on in the full entirety, only because I do get a lot of feedback from the horse on what areas are holding a lot of tension. What muscles are they over engaging and are super easily irritated and are twitching and really reactive, because that gives me information on how that horse is using its body. So I do get a lot of feedback, and I do have a general feel over a horse's musculature when I am doing my assessment on them. It's not just the joints that I feel. I kind of try and take that full body look. But that being said, I certainly, my job is a bit easier when the massage work has been done for me already ahead of time to release a lot of that tension. So they certainly go hand in hand well. But those are just some different feedbacks that I get from the horse depending on if they've had a massage already or not.
Perfect. So
now, how does it work for you if you go to massage a horse who has been adjusted or not, what differences do you find, and how does that alter the work that you do?
So thinking of it in hindsight, whether massage is before an adjustment or after, it really doesn't make a huge difference. I mean, in the perfect world, if we all had the money in our pockets, I would say before and after would benefit your horse. But obviously, that's not how the world works. And so I just go along with what the other practitioner is kind of saying. The only thing I do stipulate is that I'm not massaging a horse within like 24 to 48 hours after a chiropractic adjustment. Obviously, I want the body work that a chiropractor has done to kind of settle and allow the horse the ability to adjust to it, to feel what's going on and what changes have been made within the body. And then I can basically come out to the barn and enhance those benefits that the chiropractor has already done. But a massage after an adjustment, it can actually help the body recover faster. In the chiropractic state, it enables those nerves and muscles to align themselves correctly. And then essentially it'll help it quicker than if the adjustment was just done on its own.
Mm-hmm.
The massage can also decrease any kind of soreness that the horse is exhibiting, especially after the adjustment. They can be a little sore and tender from having those joints kind of put back into place, and muscles along with that kind of can get pulled or stretched out. So I can alleviate a little bit of that tension that's being held on there. Now, what I like about doing massage after an adjustment is that the chiropractors perform a more extensive physical examination. So that can actually help me, because that identifies what I need to treat specifically when it comes to any kind of dysfunction within the body itself. So it's really the egg and the chicken analogy, but again, it's really customized towards the individual needs of the horse, right?
Absolutely. Yeah. And I think that's the most important piece no matter what, because just like human patients, every horse patient is very individual in their needs and requirements and state of mind and everything that comes forward into it. And so there's no two that are going to be the same, and there's no black or white answer or, clear cut answer that is perfect for every horse owner and every horse. So those all need to be taken into consideration when these decisions are being made, for sure.
Absolutely. And another question that came up that can kind of tie in, and I did touch up on it a little bit, is the timing between body treatments. What's your perspective on that one?
For sure. So just to further discuss what you had already mentioned, having them too close together, I do think it can be a little overwhelming for horses, because it does stimulate their nervous system so much, and is a lot of change to their body as well. So you can imagine, especially if you're not used to the kind of work, but even when you are, if you go and have a full body head to toe massage and adjustment or any other kind of body work, like that's a lot of change for your body to go through all at once. So I certainly think that we need to give our horses the same respect and try not to overdo it for them in too short period of a time. So certainly if a horse is used to having both therapies done on a pretty consistent basis and it's kind of a maintenance thing, then keeping it within a handful of days apart, I think, is reasonable and typically tolerated well. But that being said, if a horse has never had either treatment before or has only had one and not the other, certainly giving a horse at least a week in between, I think, is the most fair for them. And then of course, depending on how they've reacted to that previous treatment as well. And so, some horses as well are sympathetically primed, which I've mentioned as well, and which basically means they're hypersensitive, and their sympathetic nervous system, which is in control of that fight or flight, is primed. And so for those, you certainly don't want to overwhelm them too much too fast, even though they can certainly benefit from both types of therapies. I certainly think it's another case-by-case basis. In a perfect world for like a maintenance care, I love if we can kind of have an even spacing between treatments, because we're generally just keeping everything going well, and there's not an area that we're typically having to make dramatic changes to. And so it really helps to just kind of keep everything going happily, on all aspects. But when there's more of a problem that we're addressing, then sometimes keeping those treatments a little closer together, so within that week or two, I find can be very helpful. Because say if I've treated a horse and I can tell they're super tight through a lot of their muscles, and I've adjusted the joints in the area, I certainly don't want those muscles to keep staying super tight for another, 3 weeks, month, or however long it may be, before you come out, because that's going to take a toll on the body as well, and they're not going to be able to use that full extent of that range of motion that we're trying to offer them. So it really is case by case basis for me, but big rule of thumb for me being not being within the first couple of days of each other, even for horses who are used to it.
Perfect. No, that's some good
what's your
insight.
take? What's your perfect case scenario?
Like I said, I prefer not to do back-to-back body work sessions, just because, like you said, it overwhelms the horse, not just mentally, but can physically overwhelm them as well. But as a massage therapist, we do have what we call the rule of three, and that's 3 massages 3 weeks apart, and it allows the body to adjust better. Obviously, and I'm sure it's the same with the chiropractic work, you can have that first initial appointment and it works, but the longevity of the adjustment or the body work session doesn't have the long-term effects that the goal is essentially for. So sometimes you do have to have the follow-up appointments. It's not a one work all kind of component. You do have to have the follow-up appointments to be able to succeed and allow the body to adjust properly. So that's the rule of 3 that we have in the massage world, is that 3 massages about every 3 weeks for the long-term benefits of a massage therapy. But yeah, I guess that kind of sums up that question really nicely.
Absolutely. Hopefully that answers some of those questions that people have had.
And the last one I have here before we open it up the floor to everybody else is just aftercare after a massage or after chiropractic work. What's your kind of go-to or follow-up with your work?
For sure. So I immediately after I've done the adjustments, I do like the horse to be able to walk around and move around. So that may look different depending on what point in the day it is and what that horse's normal routine is. So if they would normally go back outside and be able to move around and kind of free roam, I am content with, them just being able to do that. But in hand, even 5-minute little walk around, I think is very beneficial for them as well, just so they have a chance to start to move through that motion that we've just restored for them and start to get used to that and feel through it. So they don't just then stand still, say in a stall or at a hay feeder, depending on the horse, and kind of not allow things to continue to move and kind of allow them to seize back up again. So I like them to have that. And then as well as the next day off from being worked. So just letting them be a horse, again, letting them kind of move through their body and learn how things are moving again and kind of adjust to it before they're being asked to really perform or utilize their body significantly. I always give homework for my patients, whether they are human patients or horse patients. And so that can include a couple exercises. Sometimes it's just one exercise, but it's something for the owners to be able to do consistently with their horse to help to maintain the mobility that we have just worked towards restoring, as well as strengthening to be able to help them to maintain those adjustments, and then any strengthening that they may need to help reach towards their.
Sorry, everybody. We'll see if Kendle can pop back in here.
Oh, can you hear me?
Come on, Kendle, come back. There you are. Yay.
Am I here?
I thought I lost you.
Sorry, guys, don't know what happened. So I'm not sure what point that cut out. But
We heard that you always give everybody homework, and I can attest that as one of your human patients. But yeah, you were talking about how you can give like stretches and exercises to your horse patients too.
Beautiful. Yeah, so they can be range of motion like mobility exercises as well as strengthening exercises, or sometimes a combination of both. Because as much as I think that there is significant value in a degree of maintenance care, again, for the overall longevity and decreasing stress and strain on the body, it's also, I don't want to have to be out there all the time and addressing the same issues. I want there to be systems in place to maintain the improvement that we're striving for so that you can enjoy your horse the most. And so that can look like a few different things depending on what is going on and what your particular concerns are for your horse. But those are my big ones that are always giving some important exercises to do regularly, as well as giving them a little bit of time off after their treatment before returning to work. Sometimes for horses who are a bit more flared up or in an uncomfortable state, then I'll encourage the owner to, gently use some liniment and gently rub it into some areas that are particularly reactive, especially if there's going to be a period of time before they can, follow up with additional body work, depending on, again, what is going on. But sometimes I'll encourage that, or even use of like having taping done. So if they know someone who performs taping, in order to help to decrease some of the stresses in different areas of their body. And then sometimes I'll encourage use of different products. So things like Back on Track or thermal therapy type products as well, just to help decrease some stress and tension and help the horse to, warm up a little bit faster and help their tissues to recover a little bit more when they are working through some different areas of aches and pains or concerns with different things going on. So those are kind of my top most common things that I recommend for people. Again, every horse is a very case by case scenario, so it can vary, but those are my big ones that I personally recommend. What about you, Lauren? Did we lose you, Lauren?
Oh, back again. That internet keeps cutting in and out. So
oh dear.
We'll see if we can get through a couple of questions. But yeah, it's on a similar way, very much in the same way. Like I don't suggest they do any heavy work with their horses the day after any kind of body work as a massage. 24-hour downtime, allow the body just to kind of get accustomed to its new alignment and feeling that they're being exposed to for that mobility, the flexibility, the range of motion. Everything's going to kind of be different. So if they overdo the workload, this could be what you and I do. And so we kind of trying to leave it low key and slowly get them back into their regular job. Mm-hmm. The day after a massage, so that everything can just continue to be stretched out and not use any kind of collection. Homework when it comes to stretches and exercises, mobilization techniques as well. Liniment, always a good thing, especially if I hear any, or feel any kind of areas that are really holding tension or really suggest some sort of liniment. Then keep application like yourself, thermal therapy or Back on Track. So many lines out there that have those specific metals woven into fabric that can help the animal in various situations. Even a new one that's just kind of launched in the recent times is Incrediwear. They have the ability to increase circulation but not produce the heat that, say, Back on Track does. So I thought that was a really unique way to look at it, because it has a cooling effect where it draws heat out and takes it away from like the surface of the area. So because obviously too much heat can be detrimental as well.
Mm-hmm.
Now, I know you touched up on it, but complementary modalities, right? That they're out there, and there's a time and place for them all, but obviously all of them being very beneficial when used. So you touched up on Equibo.
Mm-hmm.
That one works really great in unison with our modalities
Absolutely.
as well. It's very complementary. So I often put everybody in contact with an Equibo practitioner in the area. Are there any other kind of modalities that you suggest to clients other than massage and Equibo?
Equibo and massage are definitely my top. And then the other things just being if I feel like veterinary referral is warranted, or saddle fit, or those other just regular components of horse healthcare. So those are always my big go-tos personally. Of course, there are some vets who provide acupuncture as well. And so that's another tool that I think is very complementary to the type of work that we're doing as well. But again, just kind of more that vet side of things. But I certainly do not hesitate to recommend including the vet, because I don't replace vet care, and I don't want to, and I don't. And so I am not, if you're trying to avoid vet care, you may not want to call me, because if I do feel like it is necessary, I'm going to say that, because it's not something that can be overlooked. So I love natural therapies and conservative therapies when they're warranted, but certainly I will voice my opinion if I think something different is warranted as well.
Absolutely. And then, like you asked me earlier, are there any kind of tools that I utilize with my clients? And one of the big ones, and I know you suggest this for clients as well, is the use of kinesiology tape. And in this particular picture, it's Equitape. It has so many benefits in the way it's applied and the tension of the tape, where it's applied. So it can, again, be very complementary to what you and I do. And in fact, it kind of prolongs the effects and the benefits of what we do as well. So it's a unique application, and very integrated modality that can be incorporated into any kind of body work session.
Absolutely. I love taping.
Kendle tapes me on a regular basis, and it works wonderfully. Now, what are your thoughts?
Extra help.
Right? What are your thoughts on things like light therapy and cold laser? Those are the kind of the newer ones on the market right now.
For sure. So I love them. I think that they are very valuable and can be very beneficial. Again, case by case basis, but they can really help target deeper tissues and help to promote healing, and help with pain management as well. So certainly I think that they are very valuable. That being said, it's not something that I readily offer, because there are limitations in what providers can offer what therapies. So I typically leave these things in the hands of, the people who are able to readily use them. There's some gray area with what modalities chiropractors can offer. So it's something I just kind of stay clear from right now. But that being said, I think that they are very beneficial at really targeting improved healing, decreasing pain as well, and just helping to promote healing at deeper structures than what we can typically target with our hands. So they very much go hand in hand with the type of work that we do, and I think there's a time and a place for them for sure.
Absolutely. I couldn't agree more. Yeah, for sure. Well, that's all the questions that I have. So we'll put it out there into the World Wide Web and see if any of our clients or anyone that's kind of attended tonight have any questions for Kendle and I, whether it's talking about both massage and chiro as a whole, or if you want to talk or ask any questions independently to one another. So we'll just give a few moments, see if anyone has any questions. I didn't see any pop up earlier.
Quiet group tonight.
It is a quiet group. Usually everyone has a couple of comments and feedback for us, and we're always interested in having those as well. So if there's any feedback or comments, feel free to share those with us in the chat section there. But yeah, it seems like I guess maybe we answered everyone's questions. Gave them all the information that they needed. So in that case, our phones are going to be ringing like crazy and beeping like crazy for appointments in the upcoming months, I suppose.
Well, it's getting to be that time of year, isn't it?
It is.
Hopes of some form of a competitive season.
I was going to say fingers crossed, because here in Southern Ontario, we're in stay-at-home order, and everything seems to be changing pretty rapidly when it comes to our show season, right? So
absolutely.
Yeah, I noticed that Angel Stone has changed and removed some dates, and then some of the schooling shows have either canceled dates or canceled entirely. So everything's still up in the air. But oh, we've got a question coming in from Daniela. What do you have to say, my dear? She said, wait, I have one. So see what she comes up with. Oh, thanks, Shania. Thanks for showing up. Oh, nothing's come through yet. There might be a little bit of a delay because the internet is not behaving itself this evening. Technology. We talked about this before we launched tonight, how it's not always something to be patient about. I have more patience for our clients, our horses, than I do for technology these days.
Absolutely. I could not agree more.
It hasn't popped up yet. So what I am going to do, however, is going to post our business cards here on the screen so that everyone can kind of see them, enlarge it. So if you do have any questions or concerns about the modalities we offer, you can absolutely pick up the phone, shoot us a text, or send us an email, visit our websites, Facebook page, whatever's convenient. We're all over social media. So you can absolutely send us a message, or if you have any questions or concerns, we are more than happy to address them for you. Leave that up there for a little bit, just in case anything comes through. But I think that's about it, my dear. I really appreciate you coming online again and giving us all your insight and your information, and providing us with all the benefits and examples that you came in with today. Oh, there she is. Sorry. She says, the more further I get in school, the more interested I'm getting into equine therapies that we don't really touch on. They don't touch up on in the courses. Would you guys say it would be beneficial for a vet tech to be knowledgeable in alternative therapies? I'll let you go with that one.
Sure. So I certainly think that at bare minimum, being familiar about what therapies are available out there and what they entail is super beneficial, because then when you are working in the office and you have patients coming in who have had, a colorful history of different types of treatments that they have experienced, then you can be familiar with what the animal has been used to receiving treatment-wise, and kind of the type of interactions that they've had. But then also it gives you a bit of a clinical picture as well, as to, this area of their system was being targeted with this particular therapy, and then maybe it helped them, maybe it didn't, depending on what that particular history for that patient is. So I definitely think that being familiar with the different options available out there is very valuable, because I think now more than ever, people are trying to consider all of the options and really making informed decisions when they're deciding on the appropriate care for their pet, whether it's a horse or a dog or a cat or themselves. There's a lot of different options out there these days. So at least being aware of what's available and what generally that might entail can be very helpful, both for the clinical picture for that patient, as well as just the type of therapy that animal has experienced, and how they might be bringing forward those experiences into that particular appointment that you're then experiencing with them in the vet office.
Absolutely, I totally agree. And when these kind of questions come up, I kind of reflect on both my massage job, but also my position in Omega Alpha, where we deal with a lot of veterinarians and vet techs on that component. And they don't get much education on alternative therapies. And I talked to a couple of vet students a couple of weeks ago, and they were really, really interested in what is out there, how they can find something that other clients and people are interested in. And because alternative and holistic therapies are becoming so mainstream these days, I think that any additional education that you can get in alternative therapies is always going to be an asset. So absolutely, I think vet techs should have a little bit more background information on alternative therapies, and there are so many resources that they can go to for that information. Obviously, coming today and talking to us is definitely going to be maybe a little bit of a game changer. Maybe they'll want to consider one of these therapies to coincide with their vet tech or veterinarian licenses. So yeah, absolutely, it's definitely great to have that extended knowledge for any kind of profession.
Absolutely. And even as the technician, you are not making the ultimate decisions for that particular pet that you're working with, but you're still interacting with the veterinarian who is on that case. So, I'm sure you guys absolutely communicate and, have that clinical hat on and discuss what you are noticing and the significance that might mean. And so to be able to be aware of, again, either therapies that animal may have had, or aware of what other options are out there to maybe help supplement their vet care, then I think that is a valuable conversation that you can have, even if it's not something that the vet maybe was going to recommend anyways. It's something that you can have that conversation about, and then the vet can be the one to make that decision as to whether they think that's an appropriate addition to that animal's care or not. So it's all about educated, informed decisions. And so the more that you can know about the options out there, the more informed decisions you can make moving forward.
Absolutely. Yep. I totally concur with you there, Kendle. Great question, Daniela. That was a really good one.
I love it. Thank you for thinking of those things.
Are there any other questions? We'll give you a few more seconds to make a comment or send us your questions. Doesn't look like anything's popping up
after the fact, as well, as Lauren has said, if any questions come to mind afterwards.
Yeah, we'll put those cards back up for a little bit just in case people need to jot it down. But like I said before, like, we're all over social media, and you can definitely reach out to us that way as well. And we'd be happy to talk with you and learn about your lovely horses that potentially we can come and put our magical hands on.
All those spoiled horses out there.
Yes, it's not just about spa days anymore for these athletes.
No.
Well, I haven't got any more questions coming in, so I think we could probably call it a night.
Okay.
Thank you again, Kendle, for joining me. It's always so much fun to do these Facebook Live sessions with you. We'll definitely maybe have to collaborate on another one really soon, because everyone seems to like our team approach with things.
Awesome.
But yeah, and thank you everyone for anytime. Thank you to everyone who joined today and wrote in some comments and your questions. It's very much appreciated. Like I said before, the more knowledge we can share, the better our horses can be.
Absolutely.
So, with that said, have a great evening, and I'll probably chat to you very soon.
I look forward to it. Have a great night, Lauren, and everybody else.
You too. Take care.
Thank you for joining.
Bye.
Bye.